Okay, this is going to be the video presentation for the Philanthropic project. We'll start with our community needs assessment. Um, Based on the community here in the Twin Cities, and there is the community need for early autism intervention ABA services in the Twin Cities. The population we're dealing with is children aged 2 to 7 diagnosed with ASD, autism spectrum disorder. And the purpose of this project will be to identify gaps in early intervention, behavioral health, and ABA services within the Twin Cities and surrounding communities. Some of the ways we're going to do that is surveys distributed to parents, practitioners, and educators, interviews with ABA providers, behavioral health service providers, and early education providers, as well as review reports from the Minnesota Department of Health. Many families in the Twin Cities face barriers surrounding communities face financial and systematic barriers to accessing behavioral health and ABA services. Factors include long wait lists for ABA providers, a lack of affordable or community-based intervention programs, or just simply limited education and outreach to the availability of programs in lower-income neighborhoods. This project would provide pro bono ABA opportunities to provide free or lower cost intervention services for family awaiting placement in formal services, and would offer caregiver training for home-based behavior supports. Some of the stakeholders include the Minnesota Department of Human Services, which oversees the early intensive development of behavioral intervention services across Minnesota. Others would include pediatric and family health clinics, which are vital in conducting early developmental screenings, which can provide like ASD screenings and diagnosis, and they act as a referral source for families. School districts or early childhood education can identify school-aged children who may benefit for intervention services or support generalization of early intervention skills in the education setting. Some community-based organizations might be a stakeholder, as well as they represent culturally diverse families who may face barriers to accessing ABA services. Collaboration and advocacy will be key. It'll be necessary to engage and collaborate with our stakeholders. We're going to present the program's goals to expanding access to ABA services for underserved families, share the collected data to illustrate the needs and the urgency and potential impact of the program, offer clear partnership roles such as training, who's going to provide the training, the staffing, and hosting meetings. And then sustaining engagement will be needed as well, such as holding quarterly check-ins to review outcomes and gather feedback, and recognize partner contributions publicly through newsletters or community events. Some potential funding sources for the project: Minnesota Department of Human Services grants and RFPs. These are state-funded grants for mental health and healthcare professionals. The Richard M. Schultz Family Foundation is a family foundation based in Minneapolis, which provides funding for education, human services, and healthcare services in Minnesota. And then we'll do some crowdfunding and utilize individual donors as well through platforms such as GoFundMe or Mighty Cause, which could also acquire donations from individual donors. Looking into the grant application progress, there's currently a grant for Families Moving Forward. This or a similar grant could be pursued. Families Moving Forward is an intervention program designed to help individuals born with fetal alcohol spectrum disorder, which is a similar disorder to what the project is working towards. The grant's purpose is to train clinicians as Family Moving Forward's foundation supervisors. This grant will cover the cost to provide the training to clinicians and breaks the training into two main cohorts. The request for proposal requires the following items, which are applicant and contact information, a work plan for completing the proposed training activities, copies of professional licenses and certificates of completing the trainings or of the enrollment to do so. So all those materials will need to go with the grant application process. So look at our timeline. Initiation to 60 days. We're going to complete the community needs assessment and finalize stakeholder partnerships, develop outreach materials for referral process. Secure funding, days 60 through 90, secure funding through grants and donors and sponsorships, and determine the service sites and supervisors for the pro bono services. 90 to 180. So going up into that 6-month area, we'll begin the ABA services and caregiver sessions, collect data on baseline and caregiver feedback. Month 6 through 9, we'll expand the service delivery and bring in more community partners, analyze the data and outcomes, and troubleshoot based on our findings. And then months 9 through 12, based on analysis and feedback, we will present our findings to secure more partners and funding to expand and continue the project.